Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to cover a case here that's quite complicated case, and there's some question whether I did surgery or not on it, but I can't see the absolute necessary for to do surgery here. We did send her back and get some bicuspids removed on the case, but this is a really involved case on a young lady, and this made a rather different life for her fixing this up. In fact, she got married before I got the braces off of her teeth. So anyway, let's get in here and see what we did, and if you can pick up something from this, I hope that you can, and we'll get with it here. And here is a picture that somebody has. She's got beautiful hair and beautiful facial structure, except that the chin is down too far. There's got too much vertical height of the face, and that kind of pulls on the rest of the face and kind of brings this down, and that makes it face look longer and everything. If we could shorten this, so we're going to take some bicuspids out and line this up. But this is one crooked bunch of problems here that's we had a difficult time working with some of it, but not all of it. And this is the cephalometric, and this distance down here, you see, and then up to the nose is just too much, and that messes up the face. We wish this were much shorter right in there, and it would look better. So let's see what we did here. Here it is on the cephalometric picture here. We traced it off, and really this needs to be smaller. This angle back here, 90-something degrees, needs to be a lot smaller. If we could get that to come back, but that's hard, very hard to do orthodontically. You have to go in and reduce the maxilla to get that to come down. So anyway, she's about 25 years old, I think, something like that, 23 and a half. And this is the self. Now, there's something came out here, or else she retained a baby tooth too long in here, and then the thing was lost, and this tooth leaned over in that space. And there's another thing in here that comes out when you have somebody who is a chronic mouth breather. Now, she had a lot of fillings done. She's just lived in a dental office, looked like to me at this point. Now we start straightening that out, and we'll try to line the roots of that tooth and bring it together over here a little better. And she's had some root resorption, you see, before we actually got started on that. Let me back that up and see. Now see, the roots are fairly short in some of these teeth. Now here you can't see the root structure. Here you can, and there's some root resorption when we started the case, and she had some continued on through there, but I have never lost a tooth from root resorption, but this tooth looks pretty bad right there. Several of those bicuspids, after taking out the other teeth, look quite short. Now we go in and let's look at the models now. You can learn a lot from just looking at Now we're in crossbite here, and we're just about, well, we're in crossbite back here on these teeth. And these are crowded out, the cuspids are crowded out, and the lateral is back up in the roof of the mouth up there. And you look at it from the side, and even though these are back, no overjet over thing, that's almost class 1, but it's in a crossbite. It's in a crossbite over here. Now when you look at any model on any body like that, and the maxilla is more narrow than the lower arch, and it's coming in the lower arch, it's obvious that person is breathing through the mouth. And you say, well, why is the mandible so much wider than the upper arch? Well, when you breathe through your mouth, the tongue has to stay in the bottom arch. And usually when you're already got your mouth open and breathing through it, you'll swallow with this infantile swallow pattern. And I can do it, but I doubt if any of you have been swallowing correctly most of your life, you can't hardly swallow without biting your teeth together. And so you kind of do like that. And that pulls in on your upper teeth, and your tongue doesn't go up in there and round the palate out. And then you're breathing down here, the tongue's down there in addition, and so it widens your upper arch, your lower arch out, and it tends to go in. Your upper arch goes inside of it just slightly, or sometimes the person will shift from one side to the other to help the chewing. Now we want to look at that, and this is an important thing that I wanted to spend some time with you. Look at the width of this arch right in here. See, it comes almost to a point out there. And these teeth up here at the front, no room for this lateral right in here. And this lateral coming out on this side, this is a deciduous tooth, I believe, coming out to that side. So we've got the central, the lateral, and, well, no, this is a cuspid tooth, and this is a that's a cuspid tooth, and here's a lateral, the central. So this tooth has to go in this gap right here, and the one down here should go in here, and the cuspid be back on this tooth. So we felt like there was nothing we could do other than sacrifice some teeth. So we take bicuspids in the case to bring that about. But when you see a like that, and you see the crossbite, and you see the lower widen in this way, you've got a mouth breather, you've got somebody with allergies, they're holding their mouth apart, and they're breathing through the mouth, and so they don't swallow properly, and so the teeth on the side over-erupt to some extent, and that pushes the facial structure down here, and the teeth are together even though it's down like this, and you get this long low third of the face, and that's the difficult thing to close like that. But anyway, that's adult orthodontics, and so you're going to have to do something with that. Now we go in and we've gotten the bicuspids out, I think, at this point, and we're expanding this, and that's going to push this cuspid back in here and bring this lateral up in there. This cuspid's going back. Here's the lateral here coming into this tooth, and down on the bottom we're expanding the anterior part of the bottom, but not the posterior part of the bottom arch right there. Now these are pretty tough cases. And I don't expect a lot of you to try a case like this, but you can look at them and see what can be done, and then you can do cases close to this, and gradually over a period of time you will learn to do them. Now this arch you see is coming down this way and then up this way, and you find that a lot of times in where some teeth are missing in here, this curvus fee. You're going to level this thing out just as level as we can. And I didn't get to take as many pictures on this case as I'd like to have taken, but you get busy and you just can't do all of the stuff at the same time in here. So we expand that. We're going to put a made a palatal separator, but I don't see the pictures of it. But you see how wide this arch is. This is, there's the ruler starts there. And it comes over. At this point, it's about 37 millimeters wide. And back when we started in here, it went from here to here. Now it's about 29, we'll say, and it went out to about here. So we spread that palette out. Now you can spread them and just keep spreading them. I have taken cases and used 2 palatal separators. Open out to a maximum of 1, and then you just take some time and the palate separates and comes on out, and it'll kind of flatten out a little bit. And you've got to use bands on these teeth when you put these palatal separators in, and they have to be cemented real solid as they expand out. The root of the tooth needs to go with the crown. You don't want to send the crown out. It would be something like you'd have a molar over here and one over here, and you'd push these apart, and if this tilted in, it rotates in here, the roots would be sitting like that, and that affects the airway, and that's not what you want. You want to widen that airway as much as you possibly can, so you want the roots and the teeth, the crowns to go together. So they need to be cemented in. If they don't, you have to use a powerful arch wire with a lot of buccal root torque, which is a lot more work. If you just go in there and band all the teeth that are going to be in the palatal separator, they'll stick together and you can carry the whole thing out, and you increase the airway on that person. Now, if they've got allergies, if you get the opening real big and they swell a little, they still can breathe through the nose. But if you have to, you can send that person to an ENT person, the physician, and trim the turbinates. Or a lot of times I have a deviated septum, got hit up here, I guess, and have a deviated septum which kind of blocks one side, and sometimes you need to reduce the turbinates to get a bigger air opening up there. But whatever it is, try to get it where they breathe through the nose. If they don't, you got problems, you got retention problems, and that's as long as the person lives. Let me go now to another. So there we are, we expanded out to there, and when we separated and pushed that out, the bite opened, but as we go, here's our palatal separator in there, so we're going apart with it, and as we go apart, you got to cement these teeth, and they've got to be cemented real solid, and as this goes out, it brings the roots of the teeth out. Sometimes we'll put a palatal separator on and you go apart, and they'll tilt a little bit, and then they go like this, and then we wear it for several months, and the occlusion is more on the lingual roots of the teeth, and that occlusion, working on it for several months, pushes the teeth back out, and so you get this width increases, and your airway gets a lot bigger, and you can withstand a certain amount of crud that's in the air around you that creates the allergy for you. So anyway, this is the palatal separator that we got in. And now we'll go in and line the teeth up. And when we do, and we get her breathing good, and swallowing good, and the teeth close down on that. But we've got it out there now. And that's where we started. That's where we ended. And we kept that on till we got it finished, and we came back and brought the upper teeth down, excuse me. So I screwed up there, I think. We're going to discard those. Okay. Anyway, we ended up with this young lady. I need to get this back. And she looked a whole lot better after we got through with it. In fact, she got married before we got the braces off. And this is what it looked like. I don't think I have the finishing case in it. Okay, thank you for looking. And this is something you can do. I'm sorry I didn't have the finishing thing on the case. When you're doing these and you're busy and everything, and she may have gotten married and we got the braces off and she left in a hurry or something. But anyway, I don't have any final pictures, but you can tell what we would have left. And she had a nice looking set of teeth. And thank you for watching. Hope you'll join our group and subscribe to it. And we'd like to see you again, and I'll say goodbye.